At least 3 people have been killed in the latest outbreak of yellow fever in the West Gonja District of the northern region. 12 more people are said to be suffering from the disease in the area. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes. It can kill up to 50% of victims if adequate treatment is not administered. The Health Ministry has said in a statement that the public must be worried when traveling to the Northern Region District. We have been joined on the phone by Mr. Goodman, and he will tell us more about the issue. Hello, Mr. Goodman. Thank you so much for your time.
Good morning.
When did this start?
Pardon?
I'm asking, when did this start, the outbreak of the yellow fever?
Okay, thank you very much. Apparently, if you look at the data that we have, around 22nd of December, we had a report from our lab that they received a sample from a district called West Gonja, and they did a test, and that test became positive. For a disease like yellow fever, just one case, if confirmed, becomes like an outbreak. For our first actual diagnosed case was 22nd of December. But let me say that for yellow fever, there's a series of testing that we do. What we do here is one of the preliminary community tests. So we do what we call the IgM testing using ELISA. So that one was tested positive 22nd of December. And we sent the other samples to our collaborative lab in Dakar, which we are yet to receive the final diagnosis. So I'll say the first confirmed case in Ghana was 22nd of December. Hello?
Hello, Mr. Bequin.
Yes?
Okay, so you are saying the first outbreak, you detected that in December, but exactly how critical is the situation?
Yes, I'll say that following that first case, the district had also submitted a few other samples. So they were all tested. They have submitted 7 samples. The 7, 4 were positive at our lab in Ghana. And then of the 4, 3 had died. So for 7 suspected cases, 3 had died. As I said, the main or the final confirmation is done in Dakar. So for Ghana now, we in total, using the case definition, we had 12 cases, of which 3 died. The last case that was reported was about 10 days ago. So for the past 10 days, we have never reported any case of yellow fever.
Let me find out. Okay, yes, I'm listening.
Let me say that a team from the region and the national went to the district to support them to investigate. And trying to investigate, what's happened is that there's a sub-district in West Gonja, particularly called Busunu sub-district. That is where the cases mainly came from. So almost all the 3 cases that died came from this sub-district. But one thing which is interesting is that they are not coming from one particular community. They are kind of dotted community. So in view science, technically, you realize that these cases are not linked. They are more of sporadic cases. I would say that for now, we had 3 cases that died, and for the past 2 weeks, we haven't had any other case.
What does it take to make yellow fever vaccination mandatory?
If you look at the international health regulation, apparently one disease that stands out clearly is yellow fever. Yellow fever has been on for some time, and the disease has no actual cure. So the vaccination is the main way of addressing that disease. So in the time past, when you take the vaccination, it's supposed to last you for a period of 10 years. But further research has pointed out that a dose of yellow fever is enough for a lifetime. So Ghana, as of 1st of January, we have come out clearly with documentation that says that any person who has taken any dose of yellow fever is protected for life. So normally, if you look at the airport or let's say the borders, you know, they ask for the yellow card.
Yes.
One disease which is prominent on the yellow card, I don't know whether because it's called yellow, it's yellow fever. So far as there's evidence that you have taken the vaccination, you are protected for life. One thing which came out clearly when we did the investigation was that for this sub-district called Busunu, Ghana did a mass yellow fever campaign in the year 2011. But for that sub-district, you realize that the coverage of the vaccination was less than the one that you need to get the total protection for the community. So that's why, though they had the vaccination in 2011, the community as a whole was not protected. So that's why they had these cases of yellow fever.
So if it's this serious, and why don't we take the vaccination right from infancy and end it there? Now you talk about people who are affected. How many children have been affected and how many adults have been affected?
The Ghana immunization program says that a child of 9 months should take yellow fever. So currently Ghana now, any child born in Ghana, by the time you get like 9 months, you take yellow fever. So it's part of our national immunization program. So the campaign that we did in 2011 took cognizance of the fact that the vaccination campaign didn't start that early. So persons who were 10 years and above were those who were vaccinated. But as of now, any child born in Ghana after 9 months will take the vaccine. For this outbreak, there are two children who were actually affected. You realize that these are children who were not vaccinated. And as I told you, there is a part of the sub-district which is very hard to reach. So there was a high likelihood that they were not reached during the routine vaccination exercise. And then there were a few other adults who also got the disease, mainly because of the fact that when we were doing the mass nationwide campaign, we were not vaccinated. One thing which is good is that so far as you are vaccinated with yellow fever, there is no likelihood that you can ever get the disease.
All right, Dr. Bequin, please do not go. Hold on for us because we have been joined online by the PRO of the Health Ministry, Mr. Tony Goodman. Thank you so much for your time, Mr. Goodman.
Thank you, my sister.
Yes, I want to find out what the ministry is doing about the outbreak.
Thank you very much. I thought talking to my brother, Dr. Bequin, should be enough, but let me address the question. What we are doing currently is to make sure that the needed logistics in terms of protective gear to treat people are provided. We've also made sure that we had enough public education on the ground. Medication have been also assessed and stocks have been taken, sent to the district for people to be taken care of. We've also done what we call contact tracing to trace who and which person have had contact with the deceased and those who are affected, and surveillance have been placed on these people, and we are monitoring them to see how best they can also turn out. It is as a result of all these that we've been able to contain this disease, and the past two, we've not had any new case yet. So we'll continue to monitor the situation as a ministry, and we'll make sure that the needed logistics that are supposed to go to the officers on the ground to contain and also maintain the gains achieved so far would be done.
In terms of education, how are we getting it down to the grassroots people to avoid any further serious outbreak?
As mentioned earlier, we have thanked our health promotion officers from the region and the national here to go and do what we call community sensitization programs. They also do a lot of community radio talk shows, do debates where people are invited. They go to various homes with our community health nurses to do house-to-house education, tell them the need to decongest their room and also create some airy environment where they can sleep. If they need be, they sleep outside to at least make sure that they are safe. So these are some of the things we are doing. Our officers are on the ground because you cannot do mass media campaign since this disease is located in a particular area. So that is what we are doing. We are on the ground making sure that people are told what to do.
Must we always wait for such outbreaks before education go down?
We've been doing this. As I told you, we have identified a flashpoint in terms of such outbreaks, in terms of meningitis in general. And we've started this education since last year. Normally, we do it from August in terms of meningitis. We have a lot of disease burdens as a country, and we look at where and how to do education. We've started on this particular disease, but you can do yours. But that is why I are saying that the kind of meningitis we are dealing with is not the one we had in the past, which is the cerebrospinal. This is pneumococcal, which is a different strain. But we'll continue to do it. We have been working. There are community health workers located in all districts, all areas, in terms of the CHIPS compound concept. You have health promotion officers in all districts also doing their work. So we have not waited for this to happen. We are always on the ground telling people we know the flashpoints, we know where this meningitis outbreak normally occurs, and we send people there to do education. But I believe it's because we continue to do education. That is why we've not had severe cases in other parts of the country.
All right, Mr. Goodman, thank you so much for your time and sharing with us what the ministry has been up to. Mr. Tony Goodman is the Public Relations Officer of the Ministry of Health. We still have online the man in charge of disease surveillance, Dr. Bequin, who is also telling us more about what yellow fever is doing to Ghanaians and, of course, what they are doing to curb the situation. Hello, Dr. Bequin.
Yes.
All right, so I want to find out how does it spread, so at least for those who are safe can continue to be safe.
Yes, apparently yellow fever disease is caused by a virus. So it's actually the virus called yellow fever virus. And there are two main ways of which you get the yellow fever. You have what they call the forest type and then the urban type. What happens is that there are monkeys who are mainly in the forest that harbor or they are natural hosts for the viruses. And then there's a vector, which is called the Aedes mosquito. So normally what happens is that when an individual enters into a forest, for this particular case, it happens around the Moli Reserve Park, which is very forested. So it's like when an individual enters such domain and then is bitten by that Aedes mosquito, then you have the transfer of the virus from the monkey, which is a natural reservoir, to the individual. So that is the first kind of transmission. There's also another type called the urban, whereby in that case, let's say the person who is bitten now, let's say he stays in a community. So he now comes to the community with the virus in him. And when he's bitten by that mosquito, Aedes mosquito, then he now also transfers the virus into another individual. So there are two ways of which getting the transmission is from either the forest or the urban type. What we've done is that there's a kind of entomological study that has been done that clearly demonstrates that there's a presence of the vector in the urban part of that district, that's West Gonja. So it tells you that there's a high risk of transmission of the yellow fever virus in such communities. So for that case, the best way is to make sure that people are vaccinated. So for a place like Damango, which has a very high population of the vector, because the coverage of vaccination is very high, you realize that they are not getting the disease. As I said, for that community called Gusunu sub-district, though the proportion of the vector is low, the vaccine coverage was not up to the herd immunity. So that's why they were prone to get the infection. So as a ministry announcer service, what we've marked up is that we are going to cover enough of the persons that were left vaccinated so that we get what we call the herd immunity. So in that case, even though the vectors are still present in that community, they may not get people who are susceptible to transmit the infection. So that is what has been done. And one thing is that when you have an outbreak, we have what we call the district management epidemic committees. So these committees meet and they try to mobilize resources to address the challenges that occur. So at the initial stage, all the surrounding communities and the districts were alerted that there's a yellow fever outbreak, and there were clear case definitions that were sent out. The case definition is that any person that has a fever, that has a jaundice, and that has a bleeding tendency over that period of time must report immediately to the nearest health facility. So that method has been used to search for more cases. That is why we were able to get this 12. And the system is still in place, trying to sensitize the community and then all the districts alike that any person must report as immediate as possible for them to be treated.
Thank you so much, Dr. Bequin, for your time. Dr. Bequin is with the Ministry of Health and he is in charge of disease surveillance. Still on health issues, bed bugs have invaded some senior high schools in Ho in the Volta region. The situation is forcing the students to sleep in the dining halls. Among the affected schools are Mauli and Mauko senior high schools in Ho. Correspondent Ivy Sotoji reports the beds have been rendered useless as a result. She says though the schools fumigate their dormitories every term, the exercise has done little to improve the situation. Ivy Sotoji joins us on phone to give us updates on what exactly the situation is. Hello, Ivy.
Hello, good morning.
So describe the situation and how severe it is.
Well, the situation is critical, it's very severe. I visited the campus of Mount and Mauko, or Aldinpo, and also some schools in the southern part of the Volta region, that's Kita School, Anglo Senior High, some other ones. And now, students normally sleep on the verandas, the dining hall, and classrooms because of this issue. According to them, they can't sleep in their dormitories because of the bed bugs, and they have to dry their mattresses outside during the day before they go to classes. They have to bring all their mattresses outside so that they can be dried. Even that, nothing is being done, and the situation is so bad that students can't concentrate on study anymore because they can't sleep at night. So when they go to classes, they can't concentrate. They sleep during class hours. So I spoke to one of the teachers who said the situation is getting worse because she went around one night and realized the students are suffering and much is not done about it. It appears the authorities are not doing anything about it. Now the students are appealing to government to do something urgent about it, or maybe they may not be able to concentrate throughout the news.
All right, Ivy. Basically, something is being done to help save the situation practically. All right, thank you so much, Ivy, for the update on the bed bugs. But we also have been joined online by Mr. Alexander Bwedi, who is a director at the District Education Directorate. He also joins us to tell us what the ministry is doing. Hello. Hello, sir. Thank you so much for your time.
Thank you.
It looks like the situation has persisted over some time now. What is the directorate doing about it?
Thank you so much. Thank you for linking me up to your listeners. The bed bug movement has been in fast for a while. The known method of eradicating it is by the use of chemicals to fumigate the dormitories, the bathroom, and so forth. For some time now, we've realized that there are multiple causes. One, that the chemicals are not effective in eradicating it, or we are not able to repeat the dosage on time because of financial constraints. Thirdly, the mattresses they use, the cover is either cotton, nylon, and so forth. So they get hidden into the mattress. And for now, what we are now prescribing is that mattresses should be covered with leather, that they will not be able to penetrate. Then from home, students should only be prescribed uniform. Sometimes you see them loading their trunks and boxes, and they carry this bed back from. Even if the school is able to do something about it, they carry them from home back to them. So when students back up, the house mistresses or house fathers are able to check and get them to get the unprescribed attire at home, and only then those that are prescribed by the school for wear are kept. We also want to get to parent-teacher associations so that they help in this regard, because school fees now is itemized. If it is itemized, boarding fees, medical, sports and culture, and so forth. So it means there may not be any extra funds very adequate to do this exercise. So they should see them the eradication as very important as putting up school structures or buying buses for school.
All right. Thank you so much for that piece of information. I believe the students will pay heed to that. We take a breather here. When we come back, you still will be with us on News Desk.